Yes, the interface is pretty user-friendly. Just most of the symbols are easy to understand, and it's only a few minutes to get familiar with the system and to get productive in reading an image. We processed a pretty interesting case with the AI solution of InferVision. And of course, we found some small nodules which were correctly identified. But we also had very important finding in the chest wall, where we also had the characterization as potential malignant lesion. And I think this is pretty helpful not only to concentrate on the intrapulmonary findings, but also on findings which are maybe lying on the chest wall, and also to have this characterization was pretty helpful. I think if we talk about chest CT, this is totally reasonable, because most of the routine chest CTs are reported in about 5 minutes after this initial scan, and so this is okay for a short delay, and there should be no issues. We have some experience with automatic reconstructions for CTs, for example, and this is really helpful because we can have a quick overview about anatomic region. This is helping us a lot, and also we have the possibility to detect brain hemorrhage with an AI solution. Also, this is important and is helping to detect, for example, very small and subtle subdural hematomes. Also a very important and difficult question. I think there will be cases where we can save time if we find very small lesion, which is maybe developing to as cancer, then we save time. If we see the bigger context, I think it remains a big question if a hospital can treat more patients if we use AI. So I think this question is still unclear. Yeah, so this is a really interesting and important question, I think. Right now we see several solutions already which can help the radiologist to detect or to characterize lesions. But I think there are also several questions which are still open. So for example, how to deal with false positive findings, for example, and how to deal with as a part of a referring physician, but also as a radiologist. What is more important, the radiology report, I think, but what if we have false positive image findings in the PACS, for example? So this is important to mention. And then I think still we have some room to go, right? We could also see some radiomics applications which should maybe help us to characterize lesions. And also I would like to see some solutions which are focusing on incidental findings. So for example, if we have a spine CT and in the chest part, then it would be also interesting to see if there's a lung nodule, right? So in these indications, I think it's very difficult to find a lung nodule because the radiologist is focusing on a different pathology. And in these cases, I think AI help would be really helpful.